Is your leg gonna be alright?
I can see that when he's walking, he skips a bit, and I can see he lifts the left leg a lot, and he still kind of go up the sofa, he doesn't go down, and sometimes you can see he makes some noise. That is my concern now.
You're such a spoiled boy. I hope it's something minor, it's just a tick or something that he's got and it's nothing serious. I just can't imagine going through the stress of uncertainty. We're gonna give the mouse to Leo. We're gonna give the mouse to Leo.
In my heart, start, beating and saying, no, please, no, don't be anything serious.
You know what you went through, hey? Oh, you don't want your brother to get sickies as well, no. When I started seeing that Leo was limping, I thought to myself, oh gosh, we're gonna have to go through the whole surgery again. So Bella went into surgery and she was pining at the process of losing Oscar. So our friends all got together and decided they're gonna get Leo as a friend for Isabella just to boost up her morale. Leo, he's a ball of love. He filled a hole that we had in our heart, a big hole in our heart, and he's just precious, really precious dog. We just thought, oh my gosh, we're really unlucky to be in this situation again. But we have to sort this out because we can see he's not well. Fingers crossed, hopefully he'll come out of it without going through surgery or under the knife, because I can't imagine going through that whole procedure again, to tell the honest truth.
Now you're going to the vet, you're going to see the doctor, baby.
Yes.
Let's
We're
go.
going to the vet.
Look here,
Let's
baby.
go.
Isabella, do you remember where you are?
We're going to the vet.
You're going to see Scott.
Hello, good
How
to
are
see
you?
you. Very well, very well.
Hi,
Hello, Michael.
Scott.
Hello, Pops.
Hello.
Hello, you two. Aren't they the most gorgeous couple? Aren't they?
Yes, they
Hey?
are.
Yin and yang. Hey?
Yes.
All right. Well, when are you guys coming in?
Thank you.
It's always great to see Michael and Anderson in the practice, but at the same time, you're always quite concerned as to what they're coming in for. They've had a huge amount of bad luck in the past with their animals who they adore, so I hope that it's not too serious this time around. So which one of this beautiful couple has come to see me today?
It's Leo.
It's Leo.
Oh, is that right? I know they're inseparable, but I think you've been through more than enough, haven't you, sweetheart? And she's looking great. She's been very healthy as well. She hasn't seen me for a while.
Amazing. Since she came from surgery, she's a different dog.
Gee, this guy has got some pressure on his shoulders. He's got to fill Oscar's shoes. And how's he been doing with that? Hello, mates.
He's been doing quite well.
Yeah?
The only thing, I don't know if it is a big concern, but sometimes when we play with him and we touch his leg, he sometimes cries, so I don't know if that could be an issue.
Yeah. Has anything happened to him that made you worry that, maybe it was an injury or?
No, nothing.
No.
It's just when he's walking or running, he quite often lifted leg.
It's like a
That is my concern that something could be wrong.
Yes.
One of the first things I can feel is that the leg on the left-hand side, the muscles there are smaller than the ones on the right. His hip now and just see what's going on there. Good boy. Oh, goodness. Oh, baby boy. So that's certainly where the sore bit is, isn't it, mate? Yeah, I can feel that the thigh muscle is definitely smaller than the right-hand side, and the discomfort is coming from his hip. So it's quite a obvious pain, and he seems to be quite painful. And even though he's not showing it at home, it might just mean that he is reducing the amount of jumping that he's doing, the running that he's doing. He's just being a quite sedentary little dog, and I know that they're quite keen on being cuddled and carried anyway. So, that's probably hiding a lot of the symptoms from you. So, I think the most obvious thing for us to do today is try and take some pictures of the affected joint, which is, of course, in the form of x-rays.
The yelp wasn't good news, was it? And that's not very promising when you hear him scream like that. So something must be really seriously wrong with him for him to be in such pain.
It's pretty obvious that there is an issue there, and it's definitely something that we all need to understand. You guys, I know, have been through a lot already, so we just need to make sure that we're not missing anything and that we're doing all the right things for Leo. Okay? All right. Okay,
You look
buddy.
after our dog for us, please.
I will. Gonna stay with Uncle Scott today? Will you give Daddy's a kiss? All right.
Come, little.
Leo's not yet a full-grown puppy yet. He's already got such a serious issue. It is a bit concerning for us.
All right then. I'll look after your chap, and I will see you in a few hours' time.
Okay, thank you.
All right.
Okay, thank you.
Okay.
Bye.
Bye, guys. Bye, Isabella. Say bye, daddies. Say bye.
Okay, let's see your little Leo. Okay, here we are again. Hello again.
Hello again.
We had to see the results.
Indeed, the images are ready now, so
Oh,
if you'd like to go
wonderful.
on through.
Okay, well, thank
Thank
you
you
very
very
much.
Okay, no problem.
Come on in, gents.
Hi, Scott, how are you?
Yeah,
Hello,
very
Scott.
good. Come on in. I'll give you back your boy. Be nice and gentle with him. Because unfortunately, I haven't got the greatest of news to deliver. You guys really know how to pick him. This guy has a condition called leg-calf Perthes disease. It's a mouthful, but it's a degenerative condition of his hip joint. All right. This is Leo on his back. This is his spine and his pelvis here. Now, on this side, you can see the whole section of that, the end of the femur, is a little bit longer. It's definitely abnormal. The shape isn't the classic ball. And what you can see is that big black dot in the middle there, which shows that already the femoral head is starting to collapse. It's starting to break down. And that's where the discomfort is coming from. Michael and Anson know me well enough to be able to read my face, and straight away they're anxious and upset. Sometimes life is just so cruel. So his hip joint is no good. It's cactus. It's such an extraordinary run of bad luck for these guys. They've had a dog that needed heart surgery. They've had a dog that was cruelly ripped from them as it got hit by a car. And now Leo has got a hip that's got some major problems with it. I mean, it's just so cruel.
What is the procedure now?
Sadly, the only way to fix this is surgery.
I think I wasn't expecting that at all.
No, it wasn't something we were
I
expecting.
thought something is small, we can sort it here now and then. And you have to go through the knife.
Well, there's two very clear options surgically. One is something that I can do, which is removal of the femoral head and neck. And what it leads to is a free floating leg, which sounds crazy because you think you've got to have a joint. But little dogs like this, they're very nimble, they're very light, and they can actually work very well with no hip joint. And it's the hip joint itself that's causing the pain in Leo, and that would be removed. The gold standard, however, is something called a total hip replacement. It is placing a false ball and a false socket into his hip and completely replacing the degenerate one that he's got. Now that's unfortunately not something that I can do. It's highly specialized, particularly in a little dog like him.
It's not very good news to hear that you have a little baby, such a small baby, has to go through it, unfortunately. And which, in your opinion, would be the better option then?
Well, guys, I'd say the gold standard, I think, is going and getting the total hip replacement. It's a massive surgery, but I think the benefits afterwards are considerable. And the fact that he is such a young dog and he's probably got a good 15 years to live, I think it's a worthy gamble.
A worthy gamble. I think we've got no choice but go for the better option.
Surgery again. Okay, yeah.
I think we're going to do the surgery, Scott.
hear about a total hip replacement, they're very concerned, but I think they're also resolute. They want the best for Leo and they're willing to hold his little paw through it.
Now,
Now we have to see Mike. It's going to be a big surgery.
oh God.
Hey. Now imagining the implant being so tiny and his bones being so small, and then cutting that bone of his to put that implant, it's a bit overwhelming. Hey. Yeah. Leo, every time he sees a dog, he just explodes. Shush. It's like a little monster that comes out.
Hello, Leo. He seems pretty chipper, doesn't he?
Yes.
Relaxed about the whole thing?
He doesn't know what is coming up. That's
go.
right.
Come on in. Small as he is, this left leg is a lot smaller than his right leg. He's lost quite a lot of muscle on that side as well, so which kind of fits with his problem.
Yeah.
I've been on for a little while, so.
Because we've noticed when he's walking, so he lifts up his leg all the time.
Yeah, bless him. Okay, that's great. So if you just give him a little cuddle then, I'll just quickly talk you through what it is and what the plan is. So you have standard hip replacement, which is kind of Labradors, German Shepherds, that kind of thing, which is this kind of size, I guess. And then they developed micro hip replacement, and now they've got nano hip replacement. He's a nano. He's a nano total hip replacement. Yeah.
Oh, shit.
The plan is that he's going to have a plastic on metal hip with no pain, with a normal range of motion, and he's going to be running around as a normal dog.
That's what we were hoping for.
That's the whole point. Let's go do a nano hip replacement.
Let's go.
Okay,
Yes.
right, follow me.
It's going to be really stressful until I get the call from Michael saying that the surgery's been all okay.
There you go. You want to give your daddy a kiss?
And
There you go.
good luck.
There we go. Right then. Michael, we'll speak later on.
All right,
Okay,
I'll
right.
be waiting for
Okay,
your
don't
call.
worry. We'll speak to you soon.
Thank you very much.
Come on then, you. Let's get you sorted out. Okay.
Always a funny thing to do, isn't it? There, Tickle. You're okay. There's a good boy. It's okay. Good boy.
He's going to get an epidural for extra analgesia, but we're not going to put in as much local anaesthetic as we normally do because he might be a little bit wobbly after the procedure, which is exactly what we don't want when he's got his new hip in there. So we're just going to put a bit of morphine in there for analgesia. Now, some people would argue that this shouldn't be that painful, but I think if it was my hip, I'd probably rather have as much as I can get. So it's just a morphine with no local, and it's the local that would give him the wobbly legs. So, you know, want to keep him as comfortable as we possibly can do. The thing about Leo's hip replacement is he's tiny. There's very little room for error here. So the adrenaline right now is pumping.
X-rays. Take him.
The smallest one that they make, which is what we've got, is 10, and that measures 10. So it's a bit of a no-brainer in terms of selection of implant size. As expected, given these 2 kilos, it's the smallest one they make, and he's right on the edge. Right on the edge. Like I say, this measures 10, it's 10 millimeters. It's going to be on the wire. Right, we're going in. Leo's 2.7 kilograms. Smaller dogs have been done, but it's the socket that's the issue really more than the stem, because you could potentially doctor the implant a little bit with the stem, but not with the socket. So that's my big worry, is can we get a 10mm implant into a 10mm piece of bone with some cement at the same time. 11 scalpel.
Straight.
Yeah, okay, right, so we're off. It's not going to be very far in on this titchy little thing. So there you go. That's what we've cut off. So we've taken the femoral head and a little bit of the femoral neck here as well. The new femoral head looks a bit smaller. So this is grossly misshapen. It's almost went from a circle, which would have been a similar size to that. It's kind of shortened and flattened and kind of splurged out. It looks more like a mushroom. Flush and suction. For this dog, because it's so small and so delicate, we ain't going to be putting any reamers on power tools and press and go, because within half a second you could have no bone left. So that's not what we're going to do here. What we are going to do is we're going to use a little spinal burr, and we're going to use that a bit like a paintbrush and just remove the bone bit by bit by bit. And just keep on seeing if our little trial 10mm implant will fit. And as soon as it fits, then we're good to go. Ooh, it's tight. It's really, really tight. So we just got to be very, very careful. The worry is we might run out of bone. If we go right the way to the sides, that's game over. This has to fit fairly soon, otherwise I'm not quite sure. We can file down the stem, but there's not really an awful lot you can do about the cup. There's no room for error. So if I remove not enough, it ain't gonna fit. If I remove too much, well, there's nothing for it to grip. It's important that I don't go through right the way through and out the other side. Yeah, it's getting it's like wafer thin now. I can't go any further, otherwise I'm gonna go through. So that's it. That's as far as we can go. Right, let's get the cement mixed. Go, 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 go. So Claire, you need to get around here. We're just gonna now cement this thing in. So I just gotta go for it now and hope it's good. Okay, so someone just count kind of 10 minutes or start the watch. If I move now as the cement starts to set, we're going to lose some of the bonding that we've got. But I think that looks from here quite good. Right. That's the socket there. If I move now as the cement starts to set, we're going to lose some of the bonding that we've got. But I think that looks from here quite good. Right. We're basically trying to make a hole inside the bone for this to fit with a little bit of cement around it. I can see this thing moving around inside the bone. Wow, that is getting really thin. If we go too far, we break the bone and we're a lot worse off than we were before we started. So yeah, that's a real kind of edge your seat time. Oh, not quite.
Tight.
Do you know what? I need another millimetre.
Oh.
This is so tight. So basically what I'm doing, I just keep putting this thing back in, because if this thing fits, we're good. And I think that actually
Good.
is pretty good. We've got this implant now to fit, so this is it. We're just going to now cement this thing in. There's actually a very small window of when that cement is easy to work with and actually going to be effective to use. That you've got to put it in there and get your implant in, and then once you're happy, you've got to just stay put. Because if you start moving around as the cement starts to set, you're just going to debond the thing from the cement, and it's just not going to work. Very, 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 very careful. Right. So this is the actual implant. In she goes. And I need to just try and make sure that that is lined up.
She's in.
She's in. The fact that she's in is
Good.
is pretty damn good, I have to say. Whew. That, I think, is probably one of the fiddliest stops I've ever done. And that feels pretty good. Let's go X-ray, see what it's like.
Yeah.
Okay. This is now the really stressful way for orthopaedic surgeons because there's no hiding place on the X-rays, you know. I mean, worst case scenario, this hip might have popped out. That would be a total disaster, and I'll be crying. We need to get one of those. Go, fella.
X-rays.
Fingers crossed. This view here is for us to assess the way that the stem sits in the middle of the femur, and it's really good. It's really good. It's in the middle. It's in for a start, so that makes me happy. Yeah, happy with that.
Oh, he's been such a brave little fella. We've got you a lovely soft bed for the night. There we go. He's so good. There we go. He's a good boy. Oh, it's all right. There's a good lad. There's a good boy.
One attempted jump onto the bed, and you know that hip could be not where it should be, and would be quite easy to snatch defeat from the jaws of victory here.
You got a new hip, mate. You're really lucky. Hey, he's a good boy.
Hey Maya, where's your friend Leo? Where is he? There he is! There he is, look, your little friend. Come on, you. 1, 2, 3. Oh. Here we go, look. It's a bit of a one-off, to be honest with you, but he's the smallest hip replacement that we've done, and I just wanted to really, really keep a close eye on him for the first couple of days. Look, it's your little friend. Ah, gently. Ah, gently, gently. My God, 2 babies to look after at the same time, crikey. He's had a major operation and he's got better extension and is less painful than he was pre-op already. So, you know, I'm really pleased. Go say hello to Maya. There we go. Are you going to miss him when he goes home? You're going to miss him? Oh. Right, off we go. Right then, 1 baby in. Ready to go. Yeah. There we go.
Hello.
Oh, there you go.
Oh, he's chocolatey baby.
There you go. I had to bribe her with chocolate. She was getting tired.
Has she been all right?
Yeah, she's good.
Does she like Leo?
She loves Leo.
Oh. Come on then, you little one. Oh, good girl.
Oh,
Dad.
that's a bit more like it.
Did you help him
On
with
5.
Leo?
Okay. See you later, Maya.
I'll see you later.
Excuse me. Hello, Michael.
Sir. Hello, nice to meet you.
Nice to meet you.
How do you
Anderson.
do?
Oh, hello.
Okay, here he is. Here he
Hello.
is.
Can I? Sorry.
Easy does
come
it.
to Daddy.
Easy
Come.
does it. There we go.
Yeah.
He's missed you.
This morning at 7 o'clock, I was awake waiting for the time to come here. I miss you so much, my little one. Yeah, you're going home now.
So he's been at our house the last 2 nights. You know, he's been getting waited on hand and foot. Anderson walks in and it's literally just, I'll see you later. It's quite funny.
Yeah.
The most important thing is rest.
Okay.
And we don't want to be charging around off lead, because if he does that, potentially things can move around and we can get a problem. If he's good at 6 weeks, I'll be pretty happy. And then as his exercise increases and he's off lead at 12 weeks, and I get a video of him flying around off lead, then I'll relax.
Okay,
All the
now.
best. Okay,
Thank
take
you very
care.
much.
Take it easy. See you, Leo.
Let's see Daddy and Isabella. Yeah, they are waiting for you. Yeah, they are waiting for you, my little. Let's go home. See, Isabella, where are you?
Big kisses today. I first met Astro when the RSPCA were looking to foster cats out, so I said, that's great for me. I wasn't sure whether I was going back to Australia and it would be ideal. So what's going on today? What's going on today, for goodness sake? I went to meet him and he crawled up onto my lap and I said, well, you're the one. Straight away, he made himself at home. It was as if he'd lived here all his life. Astro was gorgeous straight from the start. You gonna go and see Scott? Gonna go and see Scott? Hey?
I think Astro has a massive sense of entitlement when it comes to old Isleworth. He thinks he owns the place.
Astro?
He goes to the pub.
How's Astro today?
He's good. You come in for a drink? What would you like?
Saucer of milk for the cat?
He gets on buses.
He normally walks all the way down to the supermarket and he just thought, I'll catch the bus. And he sat on the priority seats for the elderly. Good boy. He's a good boy today.
As he goes and checks out the barber shop.
Astro,
He is extraordinary. I think this guy needs a key to the city.
you don't get a haircut today. Astro, come on. Astro, come off that sofa, please. Come on. Come on, babes. Come on. Astro, come on. You don't live here. I've had cats all my life, but I've never had one like him. He loves to go to other people's houses, and inevitably I get a phone call saying, your cat is in my house. And this has happened all over Isleworth. And people just fell in love with him. It's ever so strange. Want to get on the bus?
Despite the fact that Astro seems to be getting around old Isleworth perfectly well, he does have some issues that I'm concerned about.
Astro, come on.
His eye has got some issues and it has had for quite some time.
Come on.
In you come. Good boy.
Hi.
Come on.
Hey, Astro.
Good boy. Hello, buddy. Hello, mate. How's it going?
You being a good boy? Hey, having a lovely day?
Whenever we see cats coming into the practice, they come in a cat basket. Sometimes, but rarely, they come in people's arms, but never do they stroll in by choice on their own.
He's so unusual. I heard he gets the bus.
He does. I hear a new story about him every time she comes in.
He's famous.
He's very famous.
Famous in Isleworth.
Come in and see Scott. He's not that bad. Come on. Go in and see Scott.
Come on, mate. In you come.
You know where it is.
Come on. Astro.
Come on then, this way.
Every time Astro comes into the practice, you can't help but smile. This is an extraordinary cat. Good boy.
So, look, I haven't seen him for a little while, and I must say his eye isn't looking that
No,
great today, is it? Definitely has changed a little bit.
It weeps on and off, and
Yeah.
that white bit has got larger. And one thing I noticed is he can't see very far away. Like if I go out of view, like, you know, maybe 20 feet, he can't see me, I don't think. And then I have to come closer, and then he recognises that I'm there.
Yeah, it definitely has changed a little bit.
So Astro has had cat flu all his life, which is basically a herpes virus. And every now and again, when he's stressed, it comes out, causing injury to the surface of the eye, the cornea, and he gets corneal ulcers. These are chronic and ongoing, and as a result, his eye is scarred, and so that does mean it makes it more and more difficult for him to be able to see out of his eye. And he's now how old?
I think he's about 13.
Yeah, and he's obviously had herpes since a kitten.
Yeah, because he's had
So-
lots of flare-ups.
Yeah, so that's 13 years of flare-ups, 13 years of damage on that
Antibiotics,
eye.
Yeah.
So first of all, just put a little bit of local anaesthetic into the eye just to make proceedings a little bit more comfortable. Hey, buddy, hey? Good boy. Good boy. I know.
I know, it's tough, isn't it?
It's only a
Come on.
couple of scoop. Oh, that's sweet.
Okay.
I know, come on.
He's fit
Come
up
on.
today. You are, aren't you?
Oh, I know. Your poor eyes. It's all right. I know. That little green dot there. Can you see that, Louise? Right in the centre of the eye.
Oh, yes,
So
yeah.
unfortunately there is another ulcer present.
Oh, that's
So yet again more scar tissue for this poor eye.
Oh.
The concern I've got is that the changes that I can see on the surface of his eye might actually impede his independence. This cat needs to have 20/20 vision to be able to get around, and I'm really concerned that it's deteriorating of late. The eye is far from normal. Far from normal.
Oh, Astro, you've got herpes.
Mummy, don't say it so loudly, hey? We don't want all the neighbours to hear, do we? They won't let you in anymore.
Oh, babes. Astro's my little mate. He's adorable. I'd do anything for him. Yeah, he's a little treasure. So I'm worried something could be wrong with his vision. I'd hate him to have to lose his eye. Astro, what are we going to do if you can't go out? Hey?
Today on examination of Astro's eyes, I can see that he has got some ulcers again, bless him, which are a little bit sore and of concern. Right now, I'm really worried that he could actually lose his sight. He's got a huge amount of attachments from the iris to the lens, and that is completely abnormal. So it's hard to know if that's because of this herpes virus or not.
I'm worried about Astro's eye and worried about what life he will have if he loses his eye. He loves to go out and wander. I don't want anything to hamper that. He's a good boy, hey? I think Astro would be miserable if he was confined to the flat because he loves to explore and he's got a big life and a big wide world out there that he loves to go out and see.
Louise, I know how much you love this cat and how much he means to you.
Yeah.
I mean, this cat really is one in a million. He is so special and he just deserves the best of care. We need to ensure that this guy keeps doing the extraordinary things that he does. The good news I can deliver is with the right management and time, we'll get on top of this corneal ulcer like we have before. But it is looking more and more abnormal. But I'm just really concerned that if his vision continues to deteriorate, it makes it more and more difficult for him to keep himself safe.
Do you think he can see out of it?
He can. You know what it'd be like? It would be like if you got your glasses, you took them off, you went, and you put them back on again.
Oh, so
it's like looking
foggy.
through mist. Yeah.
Oh, okay.
Yeah. So we can treat that, that's fine. We'll continue to do that. The good news is that there is light getting into the back of the eye.
He loves life, he loves it. So I'd like to see him have it at its best.
Well, let's go and get the best for you, shall we?
get me
Shall we get the best for you?
So I'm not quite speaking to you yet,
No.
Scott.
Hey?
Almost.
You're a bit mad at me, aren't you?
Yeah.
You're a bit mad. I couldn't believe it that even after a really long consult where I was annoying him and putting dye in his eye, that he still wanted to give me a bit of affection. He wanted to rub heads with me while sitting on the weigh scales. It might have looked like he was butting heads with me. He wasn't. This is definitely all bromance. And I can totally understand why everyone in Isleworth has totally fallen in love with this cat. Treating Astro is always fantastic fun. And at the end of doing it, he was a perfect gentleman. He sort of tipped his cap to me and then just decided to jump off the table and then saunter out of the clinic.
Astro.
Boy.
Boy.
All right, mate.
You ready to go home now?
You want to go home now?
Torch is over.
Hey, you want to go on the
Come
dog
on.
scales instead?
Come on.
Astro is a totally awesome cat. And for now, our intrepid explorer can continue to enjoy his jaunts around Isleworth. Long may he reign. You're going to be our new window display. Yep.
And what would you like to drink today, huh? Milkshake,
glass of milk.
maybe? Hey, nice cocktail. What do you reckon?
Prawn cocktail.
Prawn cocktail crisps, yeah? Scampi fries, yeah? There we go.
I think he does. I think he's sharing himself. He's sharing the love with the whole neighbourhood. Everybody that knows him loves him.
So that's it for the day.
Just comes in for a mosey.
As long as the cat doesn't creep down in the night and help himself to my beer.
I don't know, he might actually. You like a drink, don't you, Astro? I'm looking after him, he looks after me, he's great company. He's just adorable. He means the world to me. I think perhaps it's destiny that maybe Astro and I are together.
It's not the thing you see every day, is it? Cats walking around in pubs. That's what he does. That's true. On another planet.
Leo.
Yeah. Come on. Where's the ball?
Go, 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 go.
Leo. Where's the ball? Leo's doing really well. We're really happy with the outcome of the surgery. Fetch, 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 fetch. No more surgeries, no more nothing.
Touch wood.
Touch wood, yes. Because the thing is,
it's a bit too much.
for the last 2 years, it's been a living nightmare. And now, hopefully, it just be
just
happy
happiness,
days.
happy days.
Just happy days from now on.
Hopefully. Praise the Lord.
Hello there, gents. This is a happy scene. Good to see you.
Hello, puppies.
Hello.
Yeah.
How are you, Leo? Leo is dancing away, chasing balls with Isabella. It's a massive difference from the last time I saw Leo.
Good boy.
Good boy.
Wow.
Where he was constantly lifting his leg up, he was in pain. But now Leo is walking comfortably and beautifully in the park. Okay, let's have a little look at him, shall we?
Yeah.
Hello, mates. Oh, that's good extension. It feels beautifully smooth, it's moving well, and all the muscles and support tissues around that hip are doing very well, so it's a really good result.
Oh, happiness.
All happiness, no more surgery. Guys, agreed?
It's a resounding yes.
You think Herb will go in today? I hope so. Let's see if he'll go in. Come on, baby. Come on, Herbie. Come on, baby. Come on. Good boy. Well done.
You are such a good boy. Herb is shaking his head, rubbing his head in the dirt, and he's generally not been himself. Herb, look, Florence has made you a card. Oscar will read it for you. What's it say?
Dear Herbie, I hope you get well soon. From Florence. Kiss, kiss, kiss.
Well, Florence and Oscar are worried about you, baby. Herb is absolutely part of the family. We couldn't be without him. If anyone asks us who's in the family, we mention Herb first, probably. He comes first in everything.
Hello, team. How you going? Hi, Herb. You guys are like looking at my kids, eh? Like blonde people everywhere, including the dog. Hello, mates. Herb's had a few problems over the years, which means that he's a little less keen on visiting the vet practice compared to when he was a puppy. And today is one of those days. Come on, it's not going to be too bad. Come on. Good lad. Come on then, let's go. Come on, big guy. Come on, it's not going to be too bad. Good boy. Good boy. Well done. There we go.
There you go.
We never want to find anything serious when it comes to a family pet, and that dog is very well loved. So I'm really hoping that we won't find anything too serious today.
His left ear, he's been rubbing it, shaking his head a bit. Not very happy. You can see it's got really dirty. He's just been trying to rub it in the garden all the time.
Sticky, isn't it? Yeah,
Yeah.
a bit sticky, a bit gross. Ooh, got a bit of a smell to it as well, hasn't it, mate? Yeah. So let me just have a little look in your ear, okay? I'm trying not to look so nervous.
Yes.
Okay, so kids, this little contraption is called an otoscope, and it's just going to allow me to have a look in his ear, okay? So I'm going to get Mum just to support his head for me there.
Okay, sweet baby.
Thank you very much. Just whilst I flip his ear back, and I'm going to have a little look, Daddy.
Good boy, Herb.
Good boy, good boy, good boy, good boy, good boy, good boy. As soon as I look down the scope, there's something very dangerous and very nasty down there, and I'm quite worried about Herb. Oh dear. Oh, yes, it's understandably sore, mate, because he has got a nasty grass seed in there. It's really, really far down the canal. I must admit, I'm a little concerned about his eardrum based on where it is, because it is so far down his ear that it could be perforating or rupturing his eardrum.
You poor love.
Grass seeds are really nasty little things. Basically, they're in the shape of an arrowhead, and every time a dog moves, it'll burrow further and further and further into the dog, and you're unable to pull them backwards because it flares, and it's just such a painful process for them to go through. So to see one in a very delicate position, teetered on the edge of an eardrum of a dog, it's serious. So he's definitely gonna have to stay with me today. We're gonna have to give him an anesthetic in order to then try and remove the grass seed. And only once I've removed it can we really see what his eardrum's doing. So it's not a simple ear infection, I'm afraid. So we have to give him something to make him sleepy, and we'll get that pesky ear sorted out, okay?
Do we have to do that now?
We do. We do have to do it now. We have to make him feel more comfortable, and he's obviously not.
So it doesn't sink anymore.
That's right, we don't want the grass seed to go throughout the other side, do we? We have to get that sorted out straight away. And then once he's woken up, we'll give you a call and we'll talk it all through.
All right, lovely. Thank you very much.
Good boy. Take me away.
Yes. I couldn't ever imagine life without her.
We've got his rather smelly toy. Is he allowed it?
Of course he's allowed it, yeah.
He carries that around with him. Do you want your toy, darling?
Just before I'm about to take Herb down to the surgery, Melanie offers me up a soft toy to keep him company. So very, very cute. More than happy to accept that.
He loves his teddy, don't you?
Come on then.
Say bye-bye. Gonna say bye-bye to Herb. Yeah, give him a big hug.
That grass seed is lodged right at the base of the canal. It can go right into the middle ear. It can affect his balance. It can affect his nervous system. So there are some very serious ramifications.
Hi, Herb.
Hey,
Hello.
so this is Herb, great name,
That's a brilliant name.
with Teddy and cards in hand, so we need to make sure they're
Okay.
ready to go.
Interesting.
Okay, champ. Yeah, let's get that nasty seed out of that ear.
Hey, handsome boy.
He's going down now. Okay, 1, 2, 3. That's it. Good boy. There we go. So far down his ear canal.
Is it?
Yeah, I'm really worried about his eardrum actually. I am concerned about Herb's eardrum. That grass seed is lodged right at the base of the canal. There's only one place it must have hit, and that is the eardrum. So only once I've removed it will I know how healthy that is. It's really bad. It's very, very deeply embedded. I'm almost certain this is going to have been down through his eardrum.
Oh, bless him.
That is nasty.
Oh, that's huge.
Can you think of that trying to burrow into your head? The grass seed we removed from Herb's ear is a nasty one. Very, very sharp. It's got the feathered edges, so it was only going in one direction, and that's going right through Herb's ear and then into his middle ear. That is exceptionally painful and cause a huge amount of damage.
Want to show Mum?
I think Herb would have been in a huge amount of pain. Surprising that he's really not showing those clinical signs. He's a very calm, easygoing fella, but I tell you what, if I had an ear that was full of grass seeds, I'd be screaming my head off. Let's have a little look at his eardrum now. There's a lot of blood and damage down there and infection, but unfortunately I can see a bit of a hole. So it might heal up. It might over time, but sadly, for this summer at least, his swimming days are over.
Oh, Herb, no more surfing the waves.
These grass seeds are very damaging to animals, and when they burrow into that level, they can cause all sorts of neurological dysfunctions. I think in this case, we've caught it just in time, because if it was any longer, it could have been a lot worse.
We must be seeing at least 2 or 3 of these cases a week now. Height of summer, the grasses are dry.
Yeah, it's a nightmare. Certainly, I mean, for owners, it's a big thing to just make sure they're checking their dog from head to toe, in the ears and between the toes, and doing that every single walk.
I'll do a check over of him just now as well.
Yeah.
There's one. There he is. Thinking about it.
Oh, there's another one.
Oh, and here as well. Add it to the pile.
Grass seeds aren't as simple as just a prickle in the foot. They can be a real disaster. They actually can harpoon any organ that they find on their way through a dog's body, and they'll only really stop when there's bone. They can cause real problems.
They're so sharp and so spiky.
Nasty little things, aren't they?
Got to be so painful in his poor little feet as well. 1, 2, 3, 4, 5, 6, 7, 8. Plus 1 in the ear, 9.
We get to 9 in total. Poor old Herb, he was focusing on his sore ear, but in fact all the while he had feet absolutely riddled with grass seeds. And no wonder he wasn't himself, poor guy.
no.
Got that one that we've taken out of his ear, an erupted eardrum, and then all these stuck in his feet, but he hasn't complained.
No.
He's been so brave. I mean, if you had those size splinters in your foot, you'd be...
Oh, you'd know about it.
Oh yeah, I'd be definitely whinging.
Yes.
For sure.
Braver than I would have been.
Okay, all right, so we can wake him up now. We'll give him some antibiotics, some pain relief, and then we'll watch him recover. Good boy.
2, 3. You're going to want his teddy to wake up with.
Of course he is.
I
There you
would.
go, mate. The damage that we've found in Herb's eardrum is significant, but I do hope it'll heal up and eventually he can get back to his water-loving ways. Good lad.
Hello. Is this the new receptionist?
Yeah.
If only. Yeah, shame. She's a rubbish typist. Absolute rubbish, aren't you?
Yeah, I can imagine.
Yeah.
Too many paws. Too many paws. When the kids left here, they were really anxious. They suddenly went into complete mode of, oh, we want to be with Herb, we want to be with Herb, will he be all right? What will they do to him? Just wanted to get back here as soon as possible and see that he was okay. How's our Herb?
He's been such a brave boy, but it's a very serious finding in that the eardrum on that left side has been perforated, unfortunately. So he's got a hole in the eardrum. So where that grass seed, which is this nasty little thing, look at that, kids, look.
Oh my gosh, that's huge.
It's gross, isn't it?
Yeah, I imagined a grass seed to be the size of a pinhead, but it was a lot bigger than I thought, and it was spiky on the end, so nasty.
Oh.
So thankfully it's out. We've flushed his ear canals, but the hole's a decent size. It might heal, it might not. So if we get water down there, that can affect his balance, it can cause infections, it can even affect his neurological systems.
I don't know how Herb will handle not swimming. He loves swimming in the sea. I mean, he loves the sea.
But also what you guys have got to promise me is that you need to start looking between his toes after every walk. The reason being is that I found not 1, not 2, but 9 grass seeds between his toes.
Oh my Lord.
See all of them? Thankfully, none of them, though, had actually gone into Herb.
They can move up.
They absolutely can. I mean, there's been a time when I've pulled them from, I've seen a hole here and pulled them out up here. So there's been some documented cases where they've actually gone all the way through and actually lodged in a dog's chest. So they are so, so dangerous. So what you need to do to help your mate is by every time you take him for a walk, you just lay him down, look in between all of his toes and look for these things, okay? And it's very tough because we're all blonde and they're blonde as well. See?
I've got really blonde hair.
I know. And that's going to be a nightmare, see? And so does Herb.
It's a bit of a job, isn't it? Oh, it's horrible. It was pretty horrifying, really.
Now, guys, just so you know, he's just had an anaesthetic, so he might be a little bit woozy, look a little bit drunk, okay?
Oh no.
Been on the one.
Drunk man.
It doesn't get that from me, by the way.
I know.
It's not from
It's
me.
very authentic.
Yeah.
Herb is pretty desperate to get home. We could see he wasn't keen on coming into the practice, but he's very keen to get out. Good boy. That's it.
Show me the dog. Where's my Herb? Give me my animal.
Oh, mate, up we go. Good boy.
Here we
go.
Hey, baby.
Where's this?
Hello.
Whoa. There we go. He's done so well, brave mite, and I think even though he's a bit wobbly, I think that he's going to be much happier at home, snuggling up with Melanie and the kids, and of course his cute little soft toy.
Where are you going to put the grass seeds?
Do you want to keep it for show and tell?
Yeah.
Yeah?
I want to keep it for show and tell.
Herb's been really lucky this time. So I'm glad we got him into the vet and we've got it all sorted in time and hopefully he'll be fine now. Thanks
All right,
very much.
Take care, no
Thank
worries.
you.
See you
What'd
later. Bye,
say?
Florence
You wanna say
Basker.
thank you?
Bye, Herb. And soft toy and card. Lovely.
All right, kids.
So, mate, your first house visit today. How you feeling?
Yeah, mate, I'm excited. I just sort of wish you'd tell me where we're going.
Local?
So, local to see a cat, a dog.
All I'll tell you is that they are very cute. So, you know, very cute indeed.
Oh, God. All right, mate. Well, I'm excited, so
Good.
let's go and do it.
That's the spirit.
Good girl. Do you want some? Yeah. Like a bit of tea. Oh.
Chippy and Speedy are like my babies. We don't have children, unfortunately, so, you know, I've bonded with them. I know, you know, people might think it's strange to have animals and call them your babies, but they really are. You know, they're just so cute, and anybody who sees them, you know, they fall in love with them straight away. Come on. Good girl. Do it again. Good girl, Chip. Well done. They're a bit like having a cat and a dog. I know them like almost inside out, and they just make us laugh with the little silly things that they do.
Speedy, what have you found? Is that your hazelnut?
Well done, Speedy.
Good girl.
Hello. Hi, I'm Scott. How are
Hi,
you?
Scott. Nice to meet you.
And
Okay,
you.
thank
This
you.
is Riaz.
Hello,
Nice to meet you. Hi.
Come in, please.
Thank you very much.
If you just follow me.
Should we close the door?
Yeah.
They're probably quite fast, I would imagine.
Exactly, yeah. Don't want
Hence
any
the
of them
name
escaping.
Speedy, right?
That's right, yeah. So this is Speedy over here,
Yeah.
and this is Chippy.
They're beautiful.
They are,
Oh,
yeah.
two absolutely adorable little ones.
I know. They're my precious babies.
And how long have you had them for?
Yeah, about 4 years now.
But they've both got some issues.
Yeah, that's right. Well, Speedy, she damaged her nail, and her new nail that's growing through doesn't grow properly, so it's quite long now,
Oh.
and she just can't seem to trim it by herself.
We see that a lot with dogs and cats.
Yeah.
And she just needs to get it trimmed a little bit regularly, and that's why I bring along my new vet.
Brilliant.
I think it means that I'll be doing the trimming then.
Well, you're an expert in trimming chipmunks nails, aren't you?
Well, I will be after today, I think.
For Riaz, I think it's a little bit of a baptism of fire.
Okay, so I'm going to let Speedy out. She'll come out by herself, but it's a bit difficult to handle her.
Absolutely,
Just a bit of
let's
warning.
try it.
So she likes to open the door by herself.
Oh, she's clever, is she?
Yeah, very clever.
Go on, Speedy.
Good
Oh,
girl.
no.
So we'll see if she gets up on the bed.
She's an inquisitive little one, isn't she?
Very inquisitive. She needs to check everything new that comes into the room. Good girl, come here.
Almost.
She's gone under the bed.
Scott, I think we've been outsmarted, mate.
Catching Speedy's fun.
She is right in the middle.
Her name should have definitely given it away. Oh, there she go for it, Riaz, go for it. Yep. Go for it.
Very crafty. I'm being outthought by a chipmunk here. It's a bit of a standoff that's going on. Hopefully we come out on top.
Keep doing what you're doing, Riaz.
Oh, and down she goes. I think she's down your left side. You are joking.
All of a sudden, she just decides to run back in her cage, which makes it a little bit easier to catch her.
She's very fast. Oh.
Good girl.
Careful.
There we go.
Oh, she's so cute.
So cute, and she's absolutely adorable. I can see why you love them so much. And also, it was incredibly funny to get Riaz to run around like that.
I don't think I'm ever going to live that down.
All right, let's trim that little nail.
Speedy damaged one of her nails a little while ago when she was 1. She's now 4, and ever since then it's been growing a bit abnormally, and it grows a bit too long, and she gets it stuck in a hammock and when she's trying to sleep. So with Speedy, what we're going to try and do is carefully just cut the nail back down to a normal length so she's more comfortable.
That's beautiful. What do you think?
Oh, that's brilliant. Thank you ever so much.
Yeah, very good. Isn't it great that you do 5 years of vet school and then you can do a manicure? All right then, Speedy, I think you can go back. Beautiful girl. And be quick with that door.
Yeah, I will do, don't worry.
There we go. Whoops. Okay. When I went to put Speedy back into her cage, she collapsed and fell off her perch. Realised that she wasn't breathing, and my heart was in my mouth the whole time. What's happening? Eh? Just grab a stethoscope, mate.
Just one more.
Okay, good girl. All right. Can feel a heartbeat there.
Yep.
Okay, good girl. Absolutely heart-stopping. It's just stress, yeah, she's just stressed. These are the moments as a vet you dread. You're doing what seems to be a minor procedure on an animal, and then they drop. My mind's racing, but I act very calmly. But at the same time, I'm thinking, what the hell just happened? Open the window. For a little creature, they're very prone to stress. So she just needs to get a good gulp of breath. Hey, there you go. That's it. Good breaths. Good girl. Good girl.
Is that normal when they get stressed? That's what
No, that's not normal. No, but she's basically fainted, is what she's done. So, haven't you? Hey?
Ah, you can't imagine how I felt when he said she's breathing. I was so relieved because I had a flash in front of me thinking that that's it, I've lost my baby.
Hey, you gave me a heart attack.
You? I didn't expect anything like that to happen.
Good girl. There's Mummy. Look at Mummy. Look at that beautiful face. There you go. And you're back.
Good girl.
Right, good girl. There we go. Let's put you there. Oh.
There you go, you scared all of us.
You're right. I had a heart attack as well. I know. Ooh, that was close. Yeah. All right, so the issues then with little Chippy. What's going on there?
Yeah, about a week ago, I noticed her underside of her belly was slightly swollen. It looked really pink on one side and not so much on the other, so I'm guessing that there's something wrong there because otherwise it would be on both sides, right? If it was, yeah, so maybe we could check that out
absolutely.
as well.
After the lessons learned with Speedy, I decided that this time around we were going to leave Chippy in her cage and try and capture her that way. Let me have a little feel back here. So, can I get you just to hold that leg?
Mm-hmm.
That's it. And Riaz, if you hold that leg.
No worries, mate.
Nice and gentle. Let's have a feel. Manpreet, I have found a lump. It is a solid mass and it is present in her mammary tissue, basically the breast tissue of your chipmunk. So it looks quite angry.
Okay.
Yeah, that is a concern.
She's my little baby and it's the size of a pea now and we don't know if it's okay, if she'll be okay or if it's something a bit sinister.
Good girl. So I know you're very worried about your little princess, but we just need to take her to the practice, have that anaesthetic done, remove that nasty mass, and then wait and see what the results show.
Okay, brilliant. Thank you ever so
All
much.
right, no
Thanks.
worries. Thank you. No worries. Okay, let's go.
We had this traumatic experience with Speedy and I never thought that would happen with her. So there's every possibility something could happen with Chippy as well.
All right, so we'll get off to the clinic now and I'll give you a call just as soon as she's woken up.
She might go into shock. She might not react to the operation too well. I'm not sure. So I am really nervous.
Hi, Kirsty.
Hey, Kirsty.
Oh, chipmunk.
Chipmunk, Kirsty, chipmunk.
Meet the chipmunk.
Come on, let's get you
Right,
downstairs.
big day.
Okay, guys, so with this we have to be quite efficient because we've got a little mammal that's prone to stress, as we certainly learnt this morning. Don't need that again. So what we'll be doing is I'm going to try and grab this little lady as gently as I can, pop her underneath the canister, we'll be gassing it down, and I'll be removing the mass as quick as possible so we can wake her up and return her to her beloved owner.
Sounds ace.
Sound good?
Good.
Yep, let's do it.
Let's go for it. Anaesthetics and surgery in small animals is always a risk, but chipmunks, they're so small and delicate, of course, it's even greater risk. So we need to make sure that with this procedure, it's as quick as it can be and she can recover as quickly as she can. Go right up to 5 to start with because she's light. With a lot of animals, we can actually give anaesthetics via an IV line or straight into their blood supply. But with the chipmunk, their blood vessels are very small. So instead what we're going to do is an inhalation anaesthetic. She'll breathe that in and then she'll be knocked out and ready for surgery.
I think it's my least favourite way.
Well, I'd like to see you try and get a vein on this one.
I think that would be a challenge.
Let's take her out and get her straight onto a mask. Okay. Let's see. What I can see here is a very angry looking mammary mass. So she's got a little lump in her breast tissue, which is quite concerning because she is an older chipmunk and therefore older people get cancer more regularly, unfortunately. And in this case, I think that might be what it is. So what we need to do is to remove it, but at the same time remove enough tissue around the outside that if it has spread a small amount, then at least we're taking it away. We're doing the job once and doing it right. Okay. Happy, Sam?
Yeah.
Yep. Yeah, it's a hard lump and actually pretty big. So I've got the lump out completely and I can feel there's a nipple there and then underneath is this hard lump, hopefully surrounded by healthy tissue, but we'll have to wait and see what the pathologists say.
It's quite a big lump, isn't it, for a little chipmunk?
It really is. I mean, if you think how big that is comparative to this animal, it's about half the size of its head.
Yeah.
So for me, that's a pretty big lump. Yeah. It's pretty difficult actually to suture up an animal this small because their skin is paper thin. So let's throw up its own set of difficulties. So as you say, Sam, we're not out of the woods yet.
No.
To have this little one recover.
Wake up.
Yes.
There we go. Do you want to go straight back into a box?
Yeah, that'd be great. Yeah, could you? Thank you. Ooh, ooh, what's that?
It's amazing how quick they wake up, isn't it?
Yeah, it's incredible. Fast metabolic rate. Okay. You're ready to go back in. You got there?
Yep.
Good girl. Sit. Right. Good. No chipmunk deaths today. I can't wait to deliver the news to Manpreet that Chippy has got through the procedure and has woken up beautifully. I know how worried she's been about this, but now I need to also tell her that that worry continues until we get the results of the pathology back from the lab. Well, Mum's going to be so relieved. Yeah, she is. Yeah, she is. You all right, sweetheart? Hey? Ready to see Mummy? Hmm? Yeah? Should we go and see Mummy then? Hey? Let's go. Come on then.
It's been a bit nerve-wracking because, of course, I didn't know, how the operation's going to go. So it's been a long wait.
Here's Mummy. Hey.
Oh, hi.
There's your little lady.
Hi, sweetheart.
Say hi, Mama.
Oh, bless.
So surgery went well.
Oh, brilliant.
And we've removed that mass in its entirety, so now it's just a waiting game. We need to find out what it is. The pathologist will give us an idea of that, and then we work out if we should be worried or not. But the good news is at least that I've removed the whole thing and the tissue around it, so hopefully it's good news.
Yeah.
All right.
Okay. I was so nervous before, but now it's such a big relief to have her finally back with me. I'm just looking forward to taking her back home.
Okay, bye-bye.
Bye, all the best. Bye, Chippy.
Hi, baby. Mommy loves you.
Hi, Manfreds. How are you? Great to see you.
You too. Come in.
Thank you very much. Hello, Chippy. How are you, sweetheart? You okay? Hello, gorgeous. How's she been?
She's been okay. She's been really good. She was a bit quiet for the first few days.
Okay, good girl. There we go. See you. It looks like it's healed quite well.
Mm-hmm.
The only thing is that I do feel that there's a little bit more of a lump that's developed further down.
And that wasn't there before.
No. I never expected to find another lump. All I was doing was to make sure that the suture line had healed well and that the lump that I previously removed had gone completely. And the unfortunate thing is the results from the lump have come back, and it's come back as not a very nice type of tumour. And it's already spread out into the tissue surrounding. I think it's a good chance that sadly this will take her quite quickly. And the fact that it's already spread the way it has, it's really not good news at all, I'm afraid. I'm so sorry.
Poor thing. So do you think she's in pain at the moment then, or?
I don't. I feel, you're still very active, aren't you? I don't think that she's in pain, but this tumour is likely to progress quite quickly. I really wanted it to be okay.
I know. I don't know, in my mind I just thought, oh, she's had the operation and she'll be
Gone,
fine.
and you've given us such a wonderful life, you really have. And what I love about you is that this is a little tiny fairy creature, and people might go, oh, it's only a chipmunk, but it means so much more to you.
Of course, she's my baby. It's like my little kid.
I know.
That's why it's so heartbreaking, because she's brought us so much joy in the last 4 years.
She knows how much you love her, and I know how much you love her, and you just need to keep doing that, okay?
Yeah.
Because she's lived so much longer than she would have in the wild,
Yeah.
by being cared for so beautifully by you. Okay?
Yeah.
And I'll be here. Okay, so if you need to speak to me about it, if you want to just have a cry on a shoulder, then I'm here.
Thank you.
Because I do know that this little creature, however small, has a big part of your heart.
She does, definitely. Both of them.
All right, baby. You've been such a sweet girl and such a good little patient.
Over the coming weeks, I'm going to spend as much time with her as possible. Just going to spend every day with her, let her run around as much as she wants to. You know, just let her have her freedom and have fun. Maybe even see if, you know, I can let Speedy out as well, and they can like play a little bit together if they want to.
You'd never know, would you?
No, I know, exactly. She's so active.
And
She's
that's,
such a good girl.
and that's one thing you do have to take away, is that ignorance is in fact bliss. And right now, she's like, oh look, I'm doing somersaults, aren't I hilarious? And oh look, there's my mum, and I love her.
Bless. I tell her that every day. I love her. Sometimes I think she probably understands, right?
Of course she does.